Hi, my name is Dr. Elisa Jones, and I'll be talking to you today about the Compassion Appreciation for Recovery in Everyone program, the CARE program. We'd like to thank Winnebago County Community Mental Health Board for funding our program through the half-cent sales tax. This is our CARE program staff. We provide substance use services, mental health services, transition to care, as well as addressing the social needs of our patients. Over 48 million U.S. adults suffer from a substance use disorder in the past year. Almost 21 million U.S. adults suffer from both substance use disorder as well as a mental disorder. And nearly 85% of the prison population has an active substance use disorder or were incarcerated for a crime involving drugs or drug use. So we know that this special population are at high risk for relapse and overdose. Winnebago County remains an Illinois county with the highest overdose rate in the state. However, there have been some good news recently. Overdose deaths in Winnebago County decreased significantly in 2024, with 64 deaths recorded through mid-December compared to 166 in 2022. We hope that programs like the CARE program can contribute to the decline that we're seeing. The purpose of the CARE program is to coordinate and continue care of justice-involved individuals upon release into our community. Our goal is to reduce recidivism and deaths due to overdose by addressing their behavioral health needs. Our CARE program started in June 2021. So our population of focus are formerly incarcerated individuals who are adults 18 years or older residing in Winnebago County. Our collaborators include University of Illinois College of Medicine Rockford, Department of Family and Community Medicine, and Winnebago County Justice Center. We have a long-standing relationship with Winnebago County Justice Center. We provide health services there as well as the Juvenile Detention Center. Our third collaborator is University of Illinois Health, Miles Square Health Center, LP Johnson, Rockford. Miles Square Health Center is a federally qualified health center. That means we provide services to those who are uninsured and underinsured. Our primary care services are provided by our family physicians, as well as resident physicians completing their family medicine residency program. Additional services, because we do provide integrated care, along with our primary care services, we provide pharmacy-related services, dentistry, and our behavioral health services. For our care program, our components are a medical home. So those who do not have a primary care provider, we will provide one there. Our behavioral health services, substance use disorder, mental health treatments. And all of our patients also receive community service linkage and case management. These are some of the treatments that we provide for substance use disorder, our medication-assisted treatments. And we provide various mental health services for both short and long-term therapy needs, cognitive behavioral therapy, trauma-focused therapy as well. And these are the community resources that we connect our patients with, from housing, getting a state ID, to employment assistance, training programs, as well as addressing transportation issues. We were recently invited to participate in the rideshare program, as well as we provide care packages, which are packages that we provide for some of our patients who are in need of some basic essentials upon release, like hygiene, toothpaste, toothbrush, soap, things like that. We also have a care phone program. So we recognize that some of our individuals are released and they don't have a phone. and we want to be able to provide them appointment updates and reminders, and they have no way to communicate with us. So we will provide a phone temporarily until they're able to get permanent access. This is our process. From our initial assessment, where we identify their behavioral health needs as well as any social needs, and then we schedule their appointments at Milescore Health Center, LP Johnson. Oftentimes, patients are receiving behavioral health services while incarcerated, but once they leave, there's a gap in services. For our care program, we provide same-day, next-day services, so no one is left behind. They're able to get an appointment immediately. We also provide ongoing assessment and case management because we know that life changes and can change fast. We want to address those social needs that oftentimes get in the way of individuals being able to participate in their behavioral health services. In terms of our impact, we have been able to serve 704 justice-involved individuals. Primarily, our patients are between the ages of 30 to 59, are male, are African American, Black, or Caucasian white. And we see a large number of our patients having co-occurring substance use and mental illness, as well as mental illness. And in terms of behavioral health conditions, by sex, we do see a large number of our patients are women in our program, have co-occurring substance use and mental illness, and a large number of men in our program experiencing mental illness. In terms of impact and social needs addressed, housing, transportation, food, employment continue to be significant challenges and barriers for our patients. And I wanted to add some participant feedback. Easy to get the care I need. They care about what I have to say. So one of the main goals of our program is to make sure that we can get our patients access to our services seamlessly. And it looks like this is being noticed. They care about what I have to say. We value each patient that receive our services. And so we're glad that they recognize how much we do care about them, and we believe in their success in our program. We've been able to disseminate our work. So last spring, we presented a poster at University of Illinois College of Medicine Rockford Annual Research Day. And we were excited and with much gratitude, excited to be invited to be highlighted in Winnebago County Community Mental Health Board's most recent impact report. So for our program, we want to reduce overdose and associated deaths, decrease recidivism, and we want to increase recovery, healing, growth, and hope. Lastly, I would want to make sure that we acknowledge our additional team members. It really does take a village, and it is a team approach to the work that we do. And I also want to thank Winnebago County Justice Center, as well as University of Illinois Health Milescore Health Center. For more information, you can click on these links or contact me directly. Thank you.